Hey, what's up, everybody? Dr. Greg Jones here on this video podcast. I still haven't found a name for yet, but we're just going to call today, Fast Vitamin IV 101 and NAD IV 101, and we'll go from there. So my guest today, I'm very honored to have Dr. Craig Koniver with me today. Dr. Koniver is the founder of Koniver Wellness. He's been practicing performance medicine for over 18 years. Is it 18 years still, or we're hitting 20 yet?
No, we're still at about 18.
All right, so that's still a very long time. Some people aren't 18 years old that may be listening. So, Dr. K was not satisfied with the disease-based model of modern medicine like myself. Dr. Koniver seeks to help his clients optimize their health and performance through time-tested, nutrient and science-driven protocols that are at the cutting edge of medicine. So Dr. K is the founder and creator of the patent-pending Fast Vitamin IV, which we're going to talk about today, as well as the NAD IV protocols that we're calling brain refuel. So we're going to talk about that today as well. Now I'm about to, this is the look what Dr. K has done portion, which I love here. Dr. K's client list includes Navy SEALs, NFL players, PGA golfers, UFC fighters, got some Hall of Fame hockey players, professional athletes, Fortune 100 executives, U.S. congressmen, well-known celebrities and TV personalities. And so Dr. K has been able to share his medicine with people all across the spectrum, of society here. In addition, Dr. K offers a comprehensive training program at the Koniver Wellness model to physicians around the world, which I can consider myself a graduate of, right? So,
yes, sir.
Still waiting on my diploma, but we'll take it, man. We'll take it. So that's Dr. K. Take it away. If there's anything else you want to add to your intro, man, go for it.
Well, I just want to say I thank you for having me on. It was, it's been really amazing getting to know you and learning about all of the great work that you're doing with all your clients and all the things you have slated up for the future. So you're one of the leaders here for sure. So this is a privilege and honor to be with you.
Oh, thanks, man. I appreciate that. I don't get that kind of props. I usually get like, Dr. Jones, where's my script at? That's the, most of the comments I get.
No, but it's true. It's true.
No, I appreciate that. So the first thing I want to talk about today is the Fast Vitamin IV. I want to talk about how did that get started? How did you come up with that?
Yeah, so I've been doing nutritional IVs with my patients for a long time, well longer than they've become popular. And, people are familiar with them now because of these hangover clinics where people go get IVs when they're hungover. And that's really become popularized probably the last 3 to 5 years. But we've been doing IVs for at least 15 years. And back then we used to do a lot of IV chelation. And IV chelation is the removal of heavy metals from the body. And people do that for 2 main reasons. One, to remove heavy metals, obviously, things like lead, mercury, arsenic, cadmium, but also to help prevent heart disease because chelation helps stabilize the blood vessels. So that original protocol we used was a 3-hour protocol. We'd add the chelating component, which was calcium EDTA, into the bag of saline, let it drip in, and it took a long time. At some point, I got my hands on the European protocol, which called for the direct administration of calcium EDTA, the chelating agent, with nothing mixed in. And that was literally a 10-second push. And when we started doing that, we were like, whoa, patients enjoyed only having to be in the office for 3 minutes versus 3 hours. Lab results were great. Patients were feeling great. So that started me thinking, these nutritional IVs work really well. And as you know, and your patients know, they really get people feeling better really quickly, right? Way different than taking oral supplements because we just don't absorb that much orally. We know intravenously we get close to 100% absorption 100% of the time. So my observation was, wow, these IVs truly work in achieving the goals we want to. What if we were proactive in using nutrients, not for chelation, but just to help boost people's, kind of nutrient system? So we just started playing around with different nutrients, and giving them in different formulations that I would come up with. I'm lucky, I've always had patients who like to experiment and try stuff. And so over time, and by time I mean years and years and years and thousands of patients, we tested these different protocols, formulas, and we came up with some that really worked. And that's kind of the origin. And from there, it's really grown. And it's just a different approach than what most people used to, where they let the IV drip in. Which there's lots of good reasons for that. Yeah. This we give as a push, and we try to give it between 45 and 60 seconds.
Okay. Yeah. So I just realized that I'm doing the listeners a disservice here. What is a Fast Vitamin IV?
Yeah. So what's included in each Fast Vitamin IV is a full range of B vitamins. So things like B1, B2, B3, B5, B6. includes a lot of magnesium, and then it includes a lot of amino acids. Amino acids are things, people are familiar with, like branch chain amino acids or essential amino acids. These are kind of the building blocks of neurotransmitters, building blocks of solid structure in the body. And the reason we went with kind of those three groups, B vitamins, magnesium, and amino acids, is because over time we've done a lot of nutrient testing, and we found that those are where people are most nutritionally deficient. So it's kind of like the low-hanging fruit. Let's give people the things they need most.
That's awesome. So with that being said, because I know when we had one of our first conversations, we had them like 45 to 60 seconds. And, going through med school, you're always taught like, all right, if you're putting a lot of nutrients in an IV, you're going to increase what's called the osmolarity, right? So how concentrated that fluid is. And if something has too high of an osmolarity, you're going to get what's called phlebitis. You're going to irritate the vein and possibly cause damage to the vein. So how are we doing the fast vitamin IV without causing phlebitis?
Yeah, no, it's a good question. I failed to mention. So when we were formulating these different formulas and trying things out, every nutrient has a known osmolarity, right? So for example, vitamin C has a very high osmolarity, which means in a solution, it disperses in a very thick manner. So vitamin C is actually, if you see it, it's very thick. It's like syrup. So that has a high osmolarity. Other nutrients have a very low osmolarity. And so when I was putting these formulas together, I would literally do the math, and I would say, okay, I would add up the different nutrients, and then we know what a vein can tolerate in terms of how we push something in the vein or how something drips in. When we push it, we have a lower or a smaller narrow field for which we can deliver that osmolarity. So it's just a question of math. And when you do the math right, you can say, okay, we're in that range, so we should be good. And that's how it's been. And we don't really see any issues with the fast vitamin in terms of burning or phlebitis. So it's very safe. Yeah. Okay.
Yeah, for sure. And again, I've been fortunate enough to do several on myself and my patients, and haven't had any experience with that. So, and I'm just, people are always like, wait a minute here. And like, no, just, and I explain to them what's going on and what they're going to feel. And it's just talking to them, right? Explaining what the expectations are and making sure they know it's a safe procedure and a safe process. So, I'm going to ask you a question that's going to lead into our next set of questions here. So, versus a traditional drip IV, because all these same nutrients we can put in a bag and we can drip them. Outside of the time, what are the benefits of the fast vitamin IV?
Yeah, it's a really good question, and it's really observational. So when we were doing, figuring out how to deliver these fast vitamins, I would ask patients, because I wanted feedback. How does this make you feel, right? Like that was the starting point. And the overwhelming majority of people say when they got a fast vitamin IV, it was like an amplification of what they wanted to feel. So their sleep was improved, their mood was better, their workouts were more intense, recovery from exercise was better. And it seemed to last for most people between 3 and 7 days. And this was in stark contrast when we, because again, we still do, but back then we used to do a lot more of the traditional drip IVs. We take a bag of fluid and we dilute it with some nutrients. We wouldn't get those same positive responses, right? And so that was interesting. The thought that if we push it, we're kind of pushing these nutrients in the cells. That's kind of how I imagine it. And then number two, when we're able to give it quickly, people's most precious commodity now is time, right? And so if we're able to push it quickly and people don't have to spend a ton of time in the office, they can do it on a regular basis. And so what I observed over time is I would have people coming in every single week for one of these, sometimes twice a week. And the analogy I use is if you eat broccoli once a month, that's great. But imagine eating it once or twice a week, it's even better. And so when you take the time element out of it for people and you're delivering something that is a little bit stronger, they're going to sign up and raise their hand. And then they're going to feel better because you're, replacing those nutrients that are depleted over time. So it's really a win-win.
Okay. So I was going to talk about the next question about, okay, what, difference or advantage of this fast vitamin IV versus a traditional drip IV. Yeah. But that being said, I want to talk about the difference or the advantage of doing this versus an IM, right? Because because all these nutrients you can inject right into a muscle, so what would be the advantage or difference between those two?
Yeah. We tried doing things IM. The trouble with IM is you're limited to a certain volume of fluid, right? And so at most people will say 5 cc's, 5 ml. That's probably high. I found about 3 is about right. At 3 mLs, you just cannot concentrate the nutrients enough. And so you're not only giving a very, very small portion versus with IV, you get in that vein and you can deliver everything. There's no limitation.
Right.
So IM is a great option for some things, obviously, like B12 shots people give IM or sub-Q. With this collection of nutrients, because each fast vitamin has 19 nutrients, we tried it IM. You just couldn't do it.
Yeah.
It's just, too much fluid.
Oh yeah. Even as a young doc, I've tried like, hey, why don't I do all these, and, do some experimentation. You realize like, wow, that is a lot of fluid, and it makes it very uncomfortable for the patient as well.
Yes.
More
Absolutely.
so than, efficacy. It's like, they just don't want to do it ever again, so.
No, I tried it on myself and it was super painful.
Yep.
To have to deliver that much fluid in several shots, and it was like, no way.
Yeah, this is not a no pain, no gain situation here. So, that's kind of what we don't want to do. So, next thing I want to talk to you about is best candidates for this treatment. Is it, because obviously we get patients across the spectrum. You got your athletes, but then you've got your older patients, you got your younger patients. So, I kind of want to make this a two-part question on best candidates and who would you consider not giving this treatment to?
Yeah, I'll answer the second question first. So there's really only three groups of people we won't want to give one of these fast vitamins to. One is pregnant women, and that's not because they couldn't tolerate it, but pregnancy itself is a liability. So we just try to steer clear of pregnancy. And then the other two groups would be patients with congestive heart failure. I'm sorry, I was thinking of NAD. So it's really just people who are pregnant. And that is it for fast vitamin, because I was thinking with NAD, the fluid issue, but there's really no other contraindication, right? And so we've given to teenagers and we've given people in their 90s. There's no medicine contraindication. There's no diagnosis or disease that's going to contraindicate it. I think the best candidates is anyone, literally anyone who's looking for an energy boost and to do it in a way that's going to be meaningful, right? Because people get frustrated nowadays, whether they're a mom with 3 kids, a busy executive, an athlete, just someone who's grinding at work all the time. They get sick and tired of having to take gobs and gobs of supplements just to be normal, if not their best. And this just provides a really good option. They come in once a week, get their fast vitamin, they're in and they're out, and they know the bioavailability, and because of the absorption of these nutrients is so high, they don't have to worry about taking all these different handfuls of supplements.
Okay, got it. And it's like, we can talk on and on about this because, we didn't touch on hey, if you're taking something oral, you're only going to get, if you're lucky, 30% of it, most people around 20% versus it's just, it can just expand and expand and expand. And, again, like I talked to you before we came on the air, is I definitely want to have you back again and get some more detail and stuff. We can do the educating process. So the last thing on the fast vitamin IV is I want to talk about, how to optimize this treatment, whether it be how often you recommend people doing it, things to do in between treatment, like how do we get the most of this treatment?
Yeah, that's a great question. Most people do it and do really well with one fast vitamin a week. And it takes again, this is what we observe, about 3 to 4 in a row for people really to notice it. Now they'll notice it every time in terms of how they feel from the actual administration, but the lights seem to turn on around the 3rd or 4th one. And by that, I mean, colors look brighter, they're really sleeping well, their mood is better. And then what we've noticed is when people fall off, they'll do a bunch in a row and then they miss a couple weeks, they say, you know what, I'm dragging, I'm missing something. They kind of really enjoy that feeling, and it makes sense because their tanks are full, they're able to operate at a higher level of efficiency. So on that note, most people do really well once a week. If you're a competitive athlete, like you mentioned, we treat a lot of professional athletes and whatnot, they're going to do it more frequently because their energy demands are so much higher, right? They're working out for 6 to 8 hours a day. That is their job. It is the highest level of importance. We have some who do 3 times a week, which is a lot. But at the higher level of competition or the more energy production one uses, twice a week, it works well. In between, like we started talking about, people do need to take some fat soluble vitamins, fatty acids, CoQ10. We don't include any of those in the fast vitamin just because they're hard. You really can't use those intravenously anyway. So vitamins A, D, E, and K, CoQ10 fatty acids is what we recommend people take orally. But for most people, once a week does the job plenty well.
Okay. Now, something I've noticed clinically is that, and this is a whole other subject, is that I've had a few patients with migraines, and it's just like, we've talked about things to do. And I was like, hey, let's, we know there's a ton of magnesium in the fast vitamin IV, and they've got some energy deficiencies. And like, hey, let's go for this. And I've done want to say about 4 to 5 migraine headache patients and gone, you know,
Yeah.
because again, and I try to explain to them like, yeah, okay, if you're in an active migraine, you're gonna get, you know, you're gonna get that gastroparesis. Like you're not, the stomach stops. You're not, anything oral isn't going to work. So anything that we do, we want to do IV so you can actually absorb it and make it work. And it's just done wonders. So I don't advertise it as a migraine treatment because it really can't, but the fact that it does work and it's another option in the toolbox just makes it even, you know, another great thing to offer our patients. So pretty excited about that.
That's a really good comment. And also I would say people, if they're fatigued, obviously people who are combating a cold or some sort of virus, you know, just adding these extra nutrients, people don't realize, but when you get those nutrients on board in such a profound way so quickly, we've had lots of people who coming down with this or that, give them a fast vitamin, sometimes we follow with glutathione, boom, you can change the character of that, you know, cold within 24 hours. It's really neat.
Oh, that is neat. Really amazing. So I want to shift gears a little bit and talk about NAD. So I started hearing about NAD actually through another podcast, and I was like, oh, what's this NAD? And they were talking about, we're going to talk about this later in the interview, about NMN and R in different forms. And so me being a inquisitive young doc, I'm like, wait a minute here. If you can get it oral, what about IV? And so I literally Googled IV NAD and boom, Craig Koniver pops up, and that was my first introduction to you. And, you know, and so now as I start explaining to my patients, like, what is NAD and what are the benefits of it? And sometimes they will look at me like, what are you talking about? Right. Cause I get all into it. I'm like mitochondrial health and NAD plus or NADH and, you know, and sometimes it can be a bit overwhelming. And so with your experience with it, when your patients ask you, what is NAD? How do you handle that question?
Yeah, no, it's a great question. And, you know, I'd like to, you know, preface it by saying, and I tell this to everyone, if anyone's any bit interested in optimizing their health and performance, I think NAD needs to be part of that conversation now. So NAD is a B3 vitamin derivative. So it's a chemical cousin of niacin. People are familiar with niacin. It actually grew up in the addiction space, studied way back in the 1930s, where they found that giving people oral NAD, for example, helped turn off cravings. So whether it be alcohol or opiates, you could really stop someone from having those cravings very, very quickly. It's quite amazing. It lost its kind of steam in conventional medicine because you can't patent NAD, and there's no drug company can come in and say, I'm going to patent this. So wasn't a lot of money behind NAD. Resurfaced in the 90s in Mexico, where people would go for 10 straight days of intravenous NAD for addictions. Again, alcohol, opiates, benzos. And honestly, there's probably nothing quite like it as a molecule to turn off cravings. I mean, it flat out works. In 2006, a gentleman from the States went down to Mexico. He had a pain medicine addiction, changed his life. And he was the one who ended up bringing NAD to the States. He opened a clinic in Atlanta. I got to know him, and then over time, he needed some help because he's not a doctor, and lots of people were benefiting from NAD. And so we started working with it, and it's been profound in terms of what it does. The way I describe it to people, it's going to help our cells make more energy. And it does through these organelles called the mitochondria, the kind of battery of each cell. And for people to know, and it's really important, a lot of the anti-aging research, anti-cancer research, anti-neurodegenerative disease research is focused on these mitochondria. And so they're super, super critical to our health, our wellness, preventing disease of all types. And so what NAD does really in a simplistic form is it up-levels the mitochondria. It makes our mitochondria more efficient. And when you make our mitochondria more efficient, you as an organism, as a human, become more efficient. And we see that taking place first in the nervous system because there's a higher concentration of mitochondria in each neuron than anywhere else in the body. And so by that, we'll use it for people who are depressed, PTSD, anxiety, traumatic brain injuries, people with dementia, Parkinson's, all these kind of things related to the nervous system. And then probably the most popular is people who are well, who want to be super well, to think clearly, have focused thoughts, mental acuity, handle stress. So NAD is this very strong and very purposeful way to reset a nervous system. And in this day and age where stress and the cumulative stress is at an all-time high, this treatment is one of the most profound ways to do that.
Okay. Yeah, you actually answered part 2 about benefits of NAD. You kind of just got that in as well. So because I treat a ton of athletes as patients, and people that are looking to improve their athletic performance and lose weight and get more out of workouts. How does that benefit them?
I think it most directly affects the recovery.
Okay.
Because if you're, again, with the nervous system, if you're making your nervous system more efficient, then you're going to be able to tolerate more exercise demands, just because you have more energy in the tank, so to speak. And then you're able, and a lot of athletic performance goes back to recovery, right? Like, how well can you compete, then recover really well to do it again the next day and be at your highest level of really just performance, goes back to being able to be a really good recoverer. So that's where we've seen it. We work with, as you mentioned, a lot of professional athletes who use it in that regard. It also then helps with the mental clarity and focus. We treated, this was a couple years ago, he's a safety in the NFL. And when he started NAD, literally the first week, that Sunday, he caught 2 interceptions. Now, was it NAD or was he just on his game? I'd say it's a little bit of both, because this is what we see. You're able to kind of hone in, and your focus, your perception, everything is locked in. And that, as a professional athlete, like getting to that zone and dealing with that stress in a calm way, NAD affords that to you very easily. So it's really cool that way.
Or he may have been playing the Bears and Mitchell Trubisky was throwing the ball. Sorry, I didn't mean that. I couldn't help myself there. So that being said, we talked about the FastVitaminIV and how that's a quicker process, the 45 seconds to 60 seconds. What's about the average time for an NAD IV?
Yeah, so NAD we didn't talk about, but NAD is an uncomfortable treatment, right? So we do drip it in, and for most people, dripped in slowly. And what it causes, and it's worth mentioning, it's uncomfortable because it causes some stomach cramping, it causes some chest pressure, leg heaviness. We think this is related to this process called mitochondrial fission, where we're helping split and remove the defective mitochondrial DNA. So we're bringing back the quality control. This is how people prevent diabetes and cancer and even the aging process. Well, that process is a negative energetic process, so it causes these feelings for people to feel. So it's a bit overwhelming. Most people on average will do the treatment in 2 hours on their first treatment, and then it marches down. So on average, most people finish the treatment between an hour, hour and a half. So it's not terrible. Yeah.
And when I've explained it to patients, and I try to simplify it, like, hey, on a mitochondrial cellular level, it's like I'm plugging you into a battery. So all those cells are going to have a lot of turnover. So you might get a headache, you might get some respiratory distress, you might get some nausea, you might get some muscle cramp. You're getting all kinds of feelings because all those cells, all those mitochondria are like, hey, wow, let's turn on, as we're improving the NAD. So,
I like that.
And they kind of understand it and they know what to expect. They're like, all right, here we go. It doesn't make it easier for them. At least they know
it doesn't make it easier.
Not a surprise.
And I tell people it's like exercising yourselves, right?
Yeah.
Like we do physical exercise, and a lot of times it's grueling. We hate it. It's really tough, but we do it for the benefits that come after the exercise, because we feel great. We feel refreshed. We can do more, be more. Same thing. You're literally doing this on the cellular level. It's cellular fitness, and there's nothing quite like it.
Oh yeah, for sure. I'm a big fan of it as well. So now I kind of want to lead into, we've kind of gone into the IV a little bit, and we started this off with, I was talking about the NR and the NMN, which are some of the oral forms. So if you want to take a second, let's talk about the benefits or the differences between NAD IV versus these oral forms, and also how you can supplement the IVs with some of the oral supplements as well, and nasal as well.
Yeah. And so a lot of NAD has gotten attention through the work of Dr. David Sinclair, who was a Harvard researcher and published a study years ago looking at the use of an oral NAD precursor. It's a molecule called nicotinamide riboside, or abbreviated NR. And he showed that he was able to give people oral NR, and that increased the NAD levels over time. And so that became kind of where a lot of the footing for NAD came about. We like the direct use of NAD. We think that, intravenous NAD is the gold standard because it directly gets into your system the most efficient way. That's not to say that NR and then its cousin molecule NMN can't work. They can. They just have to be, number one, if you're going to take them orally, they got to go through the gut. They got to be processed. So there's going to be way less bioavailability, way less absorption, and then they have to help turn into NAD. So it's several different steps. So that's why we like to go straight to the source using intravenous NAD. That's what we kind of hang our hat on, is getting the best results. However, it's not, any bit logical or practical for people to do an NAD intravenous treatment every day, right? That's just not going to happen. So as you said, we need some things to help bridge people. So NR is good. NMN, I still think the jury's out, honestly, in studying the research on, and we're hopefully going to help figure that out by, if we're able to do some testing and look at people's levels, look at their NAD levels over time. It hasn't been commercially available yet. So I think a lot of the jury's out in terms of which molecule to use, or combination NR, NMN, how much to use, how often. And then, like you said, there's different routes of administration. You can do sublingual too. And so we like actually using sublingual NAD. You can use intranasal NAD. I do think that some people respond different, like nothing works. There's not one thing that works for everyone. I encourage people to play around with it, right? Like definitely stick to the gold standard to me is you do an intravenous NAD treatment. We like a loading dose of 5 treatments in 10 days. And then most people will do a maintenance of 1 treatment per month. That's not that difficult. In between, people can do NR, they can do NMN, they can do sublingual NAD, they can do intranasal NAD. I'd like people to try it all, because then they know if they're in tune, okay, what's going to work best? How am I going to feel my best? If that makes sense.
Yeah, it does. It does. And that's how I've been kind of guiding people along with it. Like, hey, want to do our loading phase, and then, once a month, and in between, see what, obviously, being conscious of their budget, which form works better for you. And they find that, and you find your lane. So the last one I asked you about on route is I've been talking to some other docs and seeing some patients who've tried subcutaneous subcutaneous NAD. What are your thoughts on that?
We've used that more so in children than adults, mostly because children can't really tolerate an IV. And I think it can work. I don't think we have as much clinical research using it, but it makes sense, right? So if we look at, bioavailability and we put intravenous at the top, close to 100%, subcutaneous and intramuscular are going to be behind that. Probably subcutaneous is going to be higher than intramuscular, and that means injecting into the fat beneath the skin. That's probably closer to 70 to 80%, and then you go all the way down. Sublingual is probably 60%, and then oral, like we said, 20 to 30%. So if you do the subcutaneous injection, I think it's good, and people could do that, something like Monday through Friday, and see. Again, hasn't been well tested. It has for us more in children than adults, and to me, I still go by, if you're an adult, I would do the IV once a month versus having to give yourself a shot every day. Right. I think you're going to get more out of that. But I think there's something to it for sure. I think there's something to subcutaneous use of NAD, and that can fit into what people's goals, and like you said, budget. It may be a better fit.
Okay. So we started talking about this a little bit with the FastVitamin. Oh gosh, he's going to have to edit this. Started talking about this with the FastVitamin IV who are the people who we would not give a NAD IV to?
Yeah, and so pregnant women, again, because pregnancy is a liability. And then 2 other groups of people, patients with congestive heart failure and patients with chronic kidney disease. It has nothing to do with the NAD. It has to do with the fluid that we give in the IV, the volume. And they just can't tolerate extra, IV fluids per se, or extra fluids. So we just have to limit it. In that case, you're right, subcutaneous for congestive heart failure, chronic kidney disease would be good options. That's a really good point, because then you're not using the fluid and you're able to still get the NAD into their system.
Okay. Awesome. Yeah. Awesome. So almost done with you, Dr. K. A couple more questions here. Sure. So kind of putting this all together, talk to us a little bit about the brain refuel IV.
Yeah. And so we put that together. It's when the original NAD protocol, actually, which we have, and we kind of re-engineered. One, because that original NAD protocol intravenously called for using way too high dosages of NAD. They were using 3,000 milligrams at a time.
Oh, man.
We've done a lot of testing, and we like the dosage of 750 milligrams. We just found that that's the sweet spot. Other people do 500 milligrams, they'll do 1,500 milligrams. We like 750 milligrams because we've tested it, and we see that people can get through it in a relatively short amount of time and still get the benefits. But part of that original protocol, they called for using an oral amino acid solution after giving the IV. And because the fast vitamin has so many amino acids, I thought, let's try pushing that after NAD. And when we started doing that, again, the first change we made was changing the dosage. Second change we made was pushing the fast vitamin after NAD drips in. when we started doing that, things really started to take off in terms of how people were feeling, the benefits, and word got around, because that, that kind of symmetry of NAD plus these amino acids in the environment, that really makes things work really, really well. And so that's how we do it. And that's kind of what we call brain refuel, is that combination of NAD plus fast vitamin together.
Okay. That's awesome. So the one population I know we didn't talk about, and especially looking at the brain refuel IV, is those who have suffered from TBIs or concussions. Yeah. So this will be a great protocol for them, because they're getting all this supporting, amino acids and, vitamins.
You're exactly right. Yeah. And so, right. And there's so much of that, obviously, with the military servicemen who are really trying to reach, combat fighters, UFC, professional sports, obviously football, soccer, really any of these sports that there's going to be head trauma, which is most sports these days. We're really trying to make a push and make it available, because they really need it. When you jar your brain like that, and that leads to a cascading, leading to most of them getting PTSD just from the TBI, it's a really bad setup. And conventional medicine doesn't have many good therapies. They're just kind of give it time, take time off. That's really not sufficient. We want to be proactive and help kind of refuel that brain.
Okay. Awesome. Awesome. So, well, Dr. K, I appreciate the time. This has been great. It's been educational. I hope people get the foundation for wanting to know more about the fast vitamin IV and know more about NAD. So before we let you go, just, let us know where you are, your website, how to find you and all that good stuff.
Well, yeah. So thank you for having me. I always enjoy talking about this, especially with you, because you're really proactive. We've trained a lot of physicians like yourself, and you're really taking the lead. So it's really a pleasure to work with you. But people can find us on our website, Koniver Wellness. It's Koniver wellness.com. And then the only social media we're on is Instagram, and it's at Koniver Wellness. That's the best place to find us.
Okay. And your clinic is in Charleston?
We're in Charleston, South Carolina. Correct.
Oh, so you've made the move now. You're out of I think we're in Mount Pleasant before, right?
Correct. We made the move to our new office, which we're glad to be in. Yeah.
Okay. Absolutely. Awesome. Well, thanks again. We're going to have you on. Oh, thank you. We're going to have you on again soon. We're going to get a little bit more, some detail here, maybe just hone in on some stuff, because there's so many more questions I have for you, but I think we both got to get to work. So we'll get that going. So thanks again. And we'll talk to you soon.
That's great. Thanks so much. Bye-bye.
Thanks.